Are you ready to roll up your sleeve again? By the end of the week, Moderna and Johnson Johnson's COVID vaccines could be formally approved for booster shots. Pfizer has already been cleared for the extra dose. And there are indications now that you may be able to mix and match vaccines for this latest round of shots. Senior health correspondent Monica Robbins explains.
It's possible as early as this week, millions may be eligible for a COVID booster shot. With Moderna and Johnson Johnson boosters expected to receive full approval and indications, patients may be able to mix and match vaccines when it comes to the extra jab.
You don't have to worry about getting a Moderna shot if you got Moderna before, or Pfizer shot if you got Pfizer before. You really can get any of the vaccines as a booster, and it will work just as well as if you got the original.
In fact, doctors say switching it up could actually provide more protection.
Mixing and matching leads to an appropriate antibody response, in some cases possibly an even higher antibody response.
Early research showed antibody levels for Johnson Johnson recipients increased 76 times 15 days after receiving a Moderna booster. Another potential benefit?
It will make it a lot easier for state officials to make sure they're delivering boosters to as many people as possible.
It's important to note the federal study is not saying one shot is better than another. Patients should discuss their options with their doctors and pharmacists.
And the FDA is expected to announce its decision tomorrow evening. Meanwhile, a CDC advisory committee will discuss boosters Thursday and then issue its own recommendation. And by the end of the week, tens of millions more Americans could be eligible for those extra shots. It's also important to note, though, that the researchers who did the research on that mix and match study, they measured antibody level, but they did not measure immune cell response that would specifically attack the virus. So I think that's really important for people to know.
Yeah, that is key. And interesting that mixing the brand could actually be more beneficial in some. All right, boosters are not anything new. I mean, we often get boosters for other vaccines, but are you thinking that we're going to be doing this round of boosters every 6 or 8 months or so?
You know, that's the million-dollar question.
Right.
Everybody wants to know. Here's the issue that is probably going to happen. If the FDA, if these pharmaceutical companies need to change the contents of the boosters and they need to add more, Delta variant or any other variant that comes out, they have to go through the regulatory process again. So Pfizer may have been FDA approved, Moderna and Johnson Johnson are not. And if they're going to change the formulation, they have to go through that approval process all over again. So not anytime soon, but don't think for half a second that they're not working on it.
All right, good to know. Thanks again, Monica.